Namaste dosto. Welcome back to my channel. Today we will be discussing about one of the most important or one of the most commonly neglected part in the treatment of the patients, that is giving the patient diet plan. As we know that the non-communicable diseases are increasing rapidly in India and the patients needing the actual diet for management of their health, especially be it obesity or malnutrition, actually starts with the right kind of diet they consume. But apart from giving the prescription of medicines, the doctors hardly spends, most or not all, some or good number of doctors hardly spend the time to tell them what diet the patient should consume. There are a lot of misconceptions in the patient's mind about the diet. So these misconceptions will actually lead to long-term complications in the patient's health outcome. So giving the patients a proper diet is very important. Now let me come to why this is so. So we, of course, the communicable diseases, the diet plan may not be very important, but when it comes to non-communicable diseases, be it like hypertension, heart failure, kidney failure, or IBS, or many diseases are there where the diet becomes a very important part of the treatment. And giving a diet prescription in the traditional way, the traditional practice with pen and paper, is a very clumsy thing. And the doctors, most of the clinics don't have an actual practicing dietitian in their clinic. So with all these limitations, there is a solution now these days. With the help of artificial intelligence, the diet can be easily generated according to the patient history. And doctor can go through the diet and see whether the diet prescribed by the AI is correct or not, and make here and there adjustments, and in fact translate to the patient's spoken language. Like any Indian language, you can convert it to. The diet actually comes in English, but you can translate it with the help of AI only, be it Kannada, Hindi, Marathi, Gujarati, Tamil, Telugu, or Odia, Odisha, Kashmiri, whatever language, any Indian language, you can convert it and give it to the patient. That's when you give a diet, prescribed diet to the patient, it forms a kind of a binding to him and they're more likely to follow. Rather than just telling them not to eat that and this will not stick to the patient. Patients will tend to disobey the orders given by the doctor and end up getting into a wrong diet habits. Either we have seen patients coming out with a lot of weight, lost weight and gained weight. Both sides we have seen. So giving the right kind of diet is very important. Now in NICE HMS, which is our own HMS, where giving the diet prescription is very easy. And I will show the demo how the diet is generated in NICE HMS right now. Just a second.
Here you are able to see on this page I have loaded a patient for generating the diet. First, on the left side you are able to see at the age of the patient is important, and weight and height are also important. If you know the diagnosis better, write the diagnosis, it will help the large language model to generate a proper diet. So if I put the diagnosis, otherwise usually from the records, what records patient has got, it can generate. These are the previous records of the patient. You are able to see here. These are records. From this also it will take the input depending upon what all patient disease has got. And looking everything into the picture, it will generate the diet. And apart from that, you can also ask the patient what type of patient diet he is actually having. In case if he is vegetarian, vegan, ovo-lactarian, like sick diet, whatever. In this case, I am just going for a vegetarian diet. And you can ask the patient routinely what he takes, like whether he is taking morning, what he takes, like chai, uppittu and all things you can write here. His usual daily eating patterns. Once you are done with this, you just submit. Now, when I say submit, it will take some time because all these records have to be analyzed, because it is going for the reasoning model. It will take a detailed analysis of the everything and take look into the pros and cons, and it tries to follow what is recommended in ICMR. ICMR has recommended a plate for the day. that plate actually contains predominant component of the diet has to be fiber. I mean more than 45% of the diet should not be carbohydrate. That is the first rule. The government of India has told the Indians not to have too much of carbohydrate. Basically, they have told us each person should consume at least half a kilo, that is 500 grams of vegetables. In that, 400 grams is vegetables and 100 grams is green leafy vegetables. And you can have 20 to 30% of the diet calories should be obtained by proteins and rest by fat. So the hit is carbohydrate, because in India, more so in South India, the carbohydrate intake is more. The basic aim of this ICMR 2024, which was released in the year end of the last year, it is focusing on reduction in the carbohydrate diet. I think so that has to be first priority, that all of us has to, when you prescribe a patient, this has to be kept in mind. Reduce carbs, increase protein intake, and keep down on the lipids. So the calorie count has to be matched to the patient's weight. And if the patient is overweight, usually expected is at least half a kilo weight loss per week is expected from him. For example, if you have got a person who is 173 in his height, his target weight is 73 kgs, that is 100 minus 73, more or less. That will come to the normal BMI, that is 18 to 24. If you calculate also, it will come to that. That is the goal of Indian ICMR. If you got any doubts, any comments, please do suggest in my comments, and please subscribe to our channel. Now diet has come. You are able to see the diet here. The diet is actually what it has come is, it is in English. It has come in English. Now the patient could ask, he will not be able to follow the English diet. If you want to tweak this, you can tweak this, or else you can translate it here. I'll go for Hindi. Hindi. I translate the diet into Hindi and give a printout. So the whole what all is here, this diet has come, it will be translated to Hindi and you can give a printout to the patient. This all is happening inside the NICE HMS. If you want to know more about the NICE HMS, please contact us or write in the comments below. Yes, the diet in Hindi has also come now. You can see here at the top there is a Hindi diet and below we have English diet. Both are there. Now submit this, and you can take a printout and give it to the patient. You can give it to the patient now. Yeah, you are able to see the diet has come. So it is there in Hindi at the top. All the diet, and English at the below. Both are there. You can give the whole thing to the patient. This is how the diet is prescribed in NICE HMS. Kindly subscribe to our channel, and thank you for watching.